When the diastolic murmur is not audible despite the presence of severe mitral stenosis, it is called silent mitral stenosis. Mechanism and causes of silent mitral stenosis. Right ventricular hypertrophy causes clockwise rotation of the heart so that left ventricle becomes more posterior and the apex is formed by the right ventricle. Hence, the diastolic murmur of mitral stenosis is not heard at the apex. Another reason is the decreased flow across the mitral valve in very severe mitral stenosis, diminishing the intensity of the murmur. The decreased mobility of the thick and calcified mitral leaflets in severe calcific mitral stenosis may contribute to the decrease in intensity of mitral diastolic murmur. Gutenberg syndrome, pulmonary emphysema, and obesity are other possible causes for silent mitral stenosis. Severe tricuspid stenosis is another cause of silent mitral stenosis. In this case, even the transmitral gradient may be low despite having severe mitral stenosis. Transmitral gradient may be lower than expected for the severity of mitral stenosis in Gutenberg syndrome. Due to the associated large atrial septal defect, gradient between left and right atria is reduced. Hence, the left atrial pressure is lowered and consequently the transmitral gradient. But the left-to-right shunt across the AST will be high. In emphysema and obesity, the murmur of mitral stenosis may be inaudible due to poor transmission from the heart to the stethoscope. In emphysema, air intervenes while adipose tissue intervenes in obesity. Murmur audibility may improve on auscultation in held expiration in the left lateral position. Silent MS can present as pulmonary hypertension with right heart failure or with Ortner's syndrome due to compression of the left recurrent laryngeal nerve by massively dilated left atrium or pulmonary artery. Ortner's syndrome presents with hoarseness of voice. First set of references on silent mitral stenosis. Second set of references on silent mitral stenosis, its causes and mechanisms. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.